Are you experiencing chronic pain and you're wondering, how do I find a long-term solution? And can physical therapy help me? I'm going to be covering that in today's video. My name is Dr. Chris Garcia. I'm a chronic pain expert and I help people just like yourself alleviate chronic pain and get back the life that you once had. When you look at chronic pain, most people have gone through suffering for months, years, and maybe even decades. Now, how do you find a long-term result to this? Now, you have to really dive deep on why pain exists, where it's located, and you might say, well, I have chronic neck pain and no one's been able to solve that. I have back pain that no one's been able to solve, or knee pain. Now, it's very tempting to go to a local healthcare provider, your chiropractor, your massage therapist, an acupuncturist, or physical therapist, and you look for the one who has the greatest techniques. They use the latest technology, they use the best equipment, and that might work. Well, you've probably tried that. You've probably tried 5 people, maybe even 10 people, and maybe even consulted with a surgeon or even a chronic pain specialist. And the reality is, the relief through chronic pain is multifaceted. There's a lot of things, but what you have to do is get in the best hands. You have to find a local provider who understands the concepts of why chronic pain exists. It exists because you put too much stress on your body physically. That's one portion. Maybe you're exercising too much or exercising not enough, and finding the balance of how much stress to apply before your pain arises. The second piece is, do you know if you're recovering properly? Meaning you have to learn how to apply stress, but what about, is it that you're not applying enough, or that you're not recovering? For instance, when you sleep, is your sleep the problem? There's several studies that show that when we sleep, we recover. All of our tissue is now rebuilding so it can be healthy for the next day. Well, maybe you have sleep apnea and that's disrupting your ability to recover. Maybe you go for runs and then you go to sleep and you don't get good quality sleep, and then you continue to run, and it's this big cycle. So it is a sleep pattern issue, or you don't sleep enough hours, or maybe it's your bed, maybe it's your mattress, maybe it's your pillow. Then there's a nutritional aspect. Are you getting enough calories? Do you get the right nutrients? Are you taking the multivitamin? Are you taking a holistic approach to your diet? Is it hydration? Is it that you get headaches and migraines, that you don't stay hydrated? There are several reasons on why people have pain. And that last component is, do you get enough exercise to help release those neurotransmitters that create happiness and alleviate pain, things like dopamine? And when we look at this multifaceted approach, we say, well, now I have to hire a physical therapist, and I have to find a nutritionist, and maybe I have to find a sleep expert, and I have to find all these different pathways, and that's probably where you find yourself, is just lost trying to find a solution. Well, the great part is that physical therapists and physical therapy can help you with that. It's not just about your mechanics and how well your back moves and those type of things, but it's finding a physical therapist who can do it all, who understands your overall health, who understands your blood work, who understands how your heart is working and how it's not working properly when you sleep. Someone who asks you, how often do you sleep? Let's work on the sleep. Someone who understands nutrition and can provide and support that. And somebody who understands exercise and how to get back into a fitness routine properly, gradually, and safely. You're looking for a healthcare provider who can do a little bit of everything. And if you're in chronic pain, you were once tempted by the person who had all the initials behind the name because they have to be good. You were tempted by the person that was the closest to you because it was convenient. You were tempted by listening to the doctor who told you to go home and sleep, rest, take these medications, and you'll be okay. All those people seem to be just pushing you away or trying what was new at the time or best for you at the time. Well, you've come to a point where all of those things haven't worked individually, all by separate providers. The solution to chronic pain is finding a team of people who can all do it together, or finding 1 or 2 healthcare providers who can do that all and succinctly put that all together, where you're blending a little bit of rehabilitation, a little bit of adjustments to your sleep, a little bit of adjustments to your nutrition, a little bit of adjustments to your exercise program. Now you have this dashboard of, okay, now I'm moving properly and gaining strength. That's fantastic. Let's start to run just a little bit more, or play pickleball, or the things that you loved, or play with your grandkids. Okay, great. My chronic pain started to come back. Okay, great. So we slow that down. Continue to move properly. Okay, I'm moving properly. What's happening to your sleep? Well, I picked up from 5 hours to 6 hours. Great. Sleep is doing great. Rehab is doing great. Exercise is a little bit of a standstill. Now let's work on nutrition. Let's start dialing this in. And when you start making those small adjustments, you see improvement in chronic pain. But a lot of times you've been forced to take medications to do the surgery, which is a quick fix, when in reality, you know you need to make adjustments to all of these things, but no one seemed to understand that. So if you're looking for a long-term solution, your goal is to find a physical therapist who understands all of these elements to finally attack this and abolish this chronic pain for good. And now when you look for that physical therapist, ask them questions, interview them. What would you do differently with me? How long do you think this would take? And if they start to say, well, we'll take it 1 week at a time, run, quickly run. You want to find somebody who can say confidently, we're going to work on all aspects of your health, and every session we will ask you. And for the first 4 weeks, this is what we're going to focus on. The next 4 weeks, we're going to focus on this. And the next 4 weeks, we're going to focus on your exercise. And by 3 months, you should have 20 to 30% improvement, 50 to 60%, 90% improvement, that they can confidently outline that and make adjustments along the way. That's somebody who has a plan and who can adjust all those things at the same time. And those are your chronic pain specialists. So if you've been stuck and you want that final solution to get rid of this thing for good, and you've been frustrated with all the people who couldn't solve your pain, we're excited to help. The team at Sports Performance Physical Therapy can help you with these things, whether you're virtual and you live 400 miles away or you're local in the San Diego area. In either case, we can point you in that right direction, and we're excited to help. If you're interested in any of our services, you can call us or email us or go to our website and any of the information below, and we're excited to be able to help you give that quality of life back that you've always wanted. Hi, if you found this video helpful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for my weekly tips on improving your lifelong health without aches and pains. Thanks, and I'll see you soon.